Hi there, welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. So we're still talking about contraceptives this week, and we're discussing the long-acting reversible contraceptives, or the semi-permanent ones, and permanent options, including vasectomy and tubal ligation. So to start off, we're going to talk about the implant or the Nexplanon, typically placed on the upper arm by a clinician and has to be removed by a clinician. It can cause some irregular bleeding or spotting. For some people, the bleeding will decrease to the point where they may not have a monthly bleeding at all. The use is usually from anywhere from 3 to 5 years. And typically you can get pregnant right after it's removed. Now for IUDs, there is the non-hormonal option, which is the copper T or Paragard. And then there are hormonal options. So for the copper IUD, also placed by a clinician inside the uterus, it can cause some cramps and some heavy monthly bleeding. So typically for my patients who have heavy menstruation already, I usually don't recommend use of the copper IUD. I usually will tend to recommend one of the hormonal IUDs. So this one can cause some spotting between monthly bleeding. It can be left in place for up to 12 years, which is one of the reasons why many people really like this as an option. And you typically can get pregnant right after removal. For the hormonal IUDs, there are a few different options for that. And then they range from being able to be in from anywhere from 3 to 8 years, depending on which one you choose. So for some of them, you can have a lighter monthly period or bleeding, some spotting, or no bleeding at all. You typically can become pregnant right after removal also. For the more permanent options, having a vasectomy for males or tubal ligation for females, each one is basically a block or a cut. So for women, it's a block or a cut in the fallopian tubes. And for males, it's a block or cut in the tubes that basically carry sperm from the testicles. So both methods are highly effective, and reversal is quite difficult. The major difference is that the vasectomy tends to be more effective than the tubal ligation, and it tends to be cheaper. So for those in committed relationships, having a conversation about who is going to have a method done is important. And sometimes it does make sense to go ahead and do the vasectomy. But that is determined on a case-by-case basis. And it really is up to you which option is going to work best for you and your family. So the takeaway points from this week are that the long-acting reversible contraceptive options, tubal ligation, and vasectomy are the most effective birth control options there are. All of these has to be completed and removed if indicated by a trained clinician. They can all last for years and have various impacts on menstrual bleeding. And so that sometimes can be good for some people because it can decrease to little or no menstrual bleeding. And for others, like the copper IUD, you can have heavy bleeding. So come back again next week, Monday, 4/24 at 8 p.m. and we're going to have our Q&A on contraceptive options. Now, if you want to book me for a speaking engagement or follow me on social media, you can do so at Amaize Health on the platforms Twitter, Facebook, LinkedIn, and Instagram. So be sure to like and subscribe and share this YouTube channel. And remember, this is Dr. Thorpe Amaize with Amaize Health. See you again next time.